All right, here we're going to talk about different markings that are found on bones. You can find various charts that look like this on the internet, in your textbook. Um, these markings are terms that we use to describe various projections and depressions and openings found in bones. So when you call something a process, anybody who's had the same training knows what you are referring to. Or if we call it a crest or a condyle or a meatus. So some of the more common ones that you're going to come across is a process. This is a projection or bump that is found on the bone. And we have an example of that. Do we have one here? Yeah, we have one right here. On your zygomatic arch here, there is a bump towards the back end. If we are calling something a ramus, that's an extension of a bone coming at an angle with the rest of the bone. So down here, this is the pubic bone down here, and this is a ramus. It comes off at an angle. Trochanters. Trochanters are large, rough projections, not to be confused with tuberosities, which are smaller, rough projections, or tubercles, which are the small, rounded projections. What do they look like? Here is a tubercle. Here's another one. Here is let's see, what did I got here? A trochanter. Had to remember what I've talked about. Here's a tuberosity right here. And then we are also going to have things like condyles. Condyles are smooth, rounded, articular processes. So down here, they're going to be found at joint spaces. We're also going to have things like crests, and those are prominent ridges. I mentioned the iliac crest, which is right here. We're going to have lines. These are low ridges. Lines can appear pretty much anywhere, but we also see them on long bones a lot as well. Spines, a pointed or narrow process. Here's one right here coming off at the end of the iliac crest. When we're talking about a bone and we talk about a head, typically this is going to be terminology used when we're talking about long bones. This is an expanded articular end of the epiphyses that is separated from the shaft or the diaphysis by a neck. So this is a head, this is a neck. What is a neck? It's a narrow connection between the epiphysis and the diaphysis. You will find heads and necks on things like your femurs and your humerus. Trochlea are smooth grooved articular processes. They're going to be shaped like pulleys. For instance, this guy right here. Facets are small flat articular surfaces. So as you're seeing here, okay, we have bumps and we have divots, but are they involved in an articular process, or are they just a connection point for a tendon or ligament? That's going to be one of the distinct features here. Depression-wise, we have things like fossa and sulci. Fossa are shallow depressions. Here's our iliac crest, or ilium right here, shallow depression. There would be a fossa on your scapula as well. Sulcus are narrow grooves. Do we have one? Yeah, we have one right here on our humerus. Foramen. Foramen are rounded passageways into the bone for blood vessels or nerves. So they're going to be little pinpoint holes in the bone. Canals are going to be ducts or channels. Meatuses are passageways through the bone. Fissures are elongated clefts or slits. There's a fissure right here in the orbital socket. And then sinuses are chambers in a bone that are hollow, and they're typically filled with air. We find sinuses frequently in your facial bones. Now, do you need to memorize these? No, but you do need to be aware of them. So sitting down and studying them, having a chart somewhere that you can look at, flashcards, having visual examples of them is going to be very, very useful, because when we are talking about things like bone muscles and their attachment points, when we are talking about, oh, this condition or that condition, and we talk about condyles or tuberosities or meaty, we assume you know what they are. Are they a rounded bump? Are they a canal? Are they a hole? So you do need to be aware of these. Now this guy right here, and this is just the anterior view of a male skeleton. Male and female skeletons look pretty much the same. The big difference is going to be in the pelvis width. So this denotion doesn't really matter. I do encourage you to find a diagram in your book or pull up one and blow it up on your screen. As you can see, these are very, very hard to read, but you will need to identify some of the major bones on your exam. For instance, can you tell me that this is the humerus? This is the radius, or is it the ulna? It's the radius. Here's our ulna right there. Is this the femur or not? Is this the tibia? Is this the fibula? Are these metatarsals? Are these tarsals? Are these called phalanges? Carpals, metacarpals, the ribs, spine. You will need to be able to identify where we can find the major bones. Another thing that you're going to need to be able to identify is the facial bones. So this is going to include the bones of the skull. Right here we actually have the frontal bone. This is going to be one of two parietal bones, temporal, occipital here in the back. Those are the skull bones. Facial bones are going to include things like the nasal bone, found at the nose, the lacrimal bone, which is found on the medial surface of the orbital socket, zygomatic bone, which is your cheekbone, the maxilla or upper jaw bone, the mandible, lower jaw bone. If we come inside, you have bones inside your face. We have located here at the roof of the mouth, we have the palatine bone. Located in behind your nose, we're going to have, well, that's the lacrimal right there. Where is it? Where is, does this not have it? There's the vomer bone located back here in the, behind the nose. It's also shown right here. Oh, they're not showing it. Okay. There's also a sphenoid bone and an erythmoid bone, which are located inside your skull, behind your nose, but above your mandible. And those are going to make the base here of the skull and the top of the face internally. Maybe I'm missing it. Sphenoid. Yes, I am. The bright hot pink. This is your sphenoid bone. The back side of your orbital socket. And the ethmoid bone is in red. So it's right here. Right here next to our lacrimal. As you can see, very internal.